So.
Now joined on set by Dr. Desai of RestorePDX, who knows all about these types of injuries, the type that Wesley Matthews is now dealing with. Thanks for joining us. Really appreciate you being here.
Thank you for having me.
Let's start out by talking about maybe the moment of injury and the indications we saw from Wesley Matthews on the InFocus Mondo pad, the new way to collaborate.
So here's a image of Wesley as he's making that cut. As he started, and you can see this hyperdorsiflexion right here of that ankle, the position of the ankle. And as soon as he made that cut, he felt the pop and had that tear. And we're going to go to the next screen here, which is a diagram of that, kind of the same position that Wesley was in. And this is the Achilles tendon, so a really strong, powerful cord in the back of the leg. And you can feel that thick band in the back of your ankle. And you can see here where it's ruptured, and that's kind of where likely he had that tear. And so it's extremely strong. It takes about the force with jumping about 12 times normal body weight. And it's about 4 times stronger than the ACL. So you can imagine how powerful that is and what kind of force it takes for it to tear.
Doctor, if that's an asymmetric type of injury, or asymptomatic, I should say, what type of preventative measures can you take to keep from having something like that happen?
Well, that's a good question. I mean, one, as far as, coaching staff really, and the training staff staying on top of their athletes, making sure that they can even educate them about, look, if you feel, so even if it's asymptomatic, but they can evaluate their Achilles, just like feel it. If it's getting thickened, that's one of the main signs. There's a really cheap way to do is ultrasound, and I was talking to, we're having a fellow coming in from, a doctor coming in this fall from Emory, and we were talking about doing maybe a study of athletes to look at, with ultrasound is really cheap, and you can look at it maybe pre-season and see what the rupture risk is, but there's nothing definitive right now. And I had 2 close friends that had this happen to them this year without any warning. They swear they had no pain before. And
you have the rope analogy also to show us of a fraying of the rope.
Yeah, let's see if we have that. So this is kind of what we talk about with tendinosis, or underlying disease. Most of us think that when an athlete has this tear, that it's usually not a tendon that's looking like this. This is kind of that native, perfect-looking tendon, nicely taut and wound. Those type 1 collagen fibers in line with each other. Here, probably the status of the tendon was somewhere like this, where there's a increase in size, there's small partial tears and wear and tear. And so you generate those types of forces, and then you have that rupture.
And you may not feel that. That may not.
This may be, yeah, they may be asymptomatic, okay? And then one of the ways, the next way we'd, when Wesley had that injury, they're going to put him in an MRI. Obviously, this is not his case, but this is what they're going to be looking at. This is the normal appearance of on MRI of that nice dark line there. That's the tendon. And then we see here this rupture, okay? And on this, on the Mondo pad, you can see that this is already thickened. This doesn't look like the one over here. And then the ends, there's this gap, and that's fluid. And so that's what the surgeons have to go in and tie together.
The normal timetable for a return, it's obviously different from a normal person to an athlete.
Sure.
And the opposite of what we'd expect.
Yeah, for an athlete, especially a high-level athlete that's going to be running, jumping, and doing those types of explosive activities, we want about an 11-month time span. They really have to be ready to jump back into it. We don't want to get them back in 3 main concerns we have when we're doing the repair. 1 is the function and strength of the tendon. 2 is the risk of re-rupture. And then 2 is the timeline for return to activities. So we have to kind of balance all of those.
There are also alternatives to surgery, but not necessarily in a case like Wesley Matthews. And just so people know, you aren't Wesley Matthews' doctor, but you deal with this injury all the time.
Yeah, we see this injury, and oftentimes more in the professional level athletes. And so there are the large-scale studies have shown there's not that much of a difference for kind of the layperson, non-professional athlete in non-surgical versus surgical repair. At the end of the day, we all turn out to be about the same. And so there are some things. We're going to go to a picture here. This is an image of someone that had an Achilles tear. This wasn't a complete rupture where the ends came apart, but you can see the tear is here, that white band, about a 70%. This is a slice through here, right here, and we can see that the tear is this white part. And this was a platelet-rich plasma type of injection, or regenerative medicine injection. And you can see the progression of healing to complete healing after 2 injections in about 4 months. So they had no surgery. They left with the needle. So you kind of avert a lot of the side, complications and risk factors with surgery with this type of therapy. And we have a lot of data. We've been doing this thing about 6 years, and so the anecdotal data is there, meaning what we see in the clinic and what we see on our MRIs and with follow-up, but the large-scale studies are still being done. We don't have that data.
And there's still a belief now with a 29-year-old Wesley Matthews that he should be able to return to full strength from this type of
injury. It's a high
probability,
much greater than 70%, that he's going to do very well with this. And with that, nobody's going to not do surgery on a high-level athlete. We need to surgically repair that and then get him the rehab and allow him the time to heal.
Dr. Desai from RestorePDX, thanks so much for your time. Really appreciate it.
Thank you for having me.
Thank you.
Absolutely. You can share your thoughts as well on this and other topics by using the hashtag Blazers.